Hi, my name is Lisa Wynne, and I am the Parkinson's Disease Nurse Specialist for the Parkinson's Association of Ireland. So I just wanted to discuss the issue of anxiety today, and I'm going to share with you a short slide presentation. So neuropsychiatric symptoms with people with Parkinson's may include anxiety, apathy, and depression, amongst others, but these are the three main ones that I'm going to touch on today. The feelings of anxiety, and we've all felt them. It may be fear, turmoil, dread, worry, apprehension, feeling threatened, or stress. But remember that it is a normal feeling to an abnormal situation. It's normal to experience anxiety in relation to a threat or a danger to yourself. It's the fight, flight, or freeze that we all experience in situations. There is a chemical imbalance within people with Parkinson's, which is seen an imbalance between noradrenaline and serotonin. So these would be responsible for your fight or flight reaction. And it's a normal response to stressful life events. So be it family, work, or environmental stress. Genetics also plays a role in anxiety. And COVID-19 for everybody has caused increased anxiety and stress in our lives. But anxiety may also be an off anxiety. So if you are a person with Parkinson's and you experience off symptoms, this then can trigger anxiety and a spiral then of worsening off symptoms and worsening anxiety. And anxiety is unpredictable for many people. As I said, it is a normal response, but it is just to be aware of the potential triggers that you may have. With people with Parkinson's disease is a disease that has heightened anxiety attached to it, and it affects approximately up to 40% of people with Parkinson's disease. This true number I would believe to be a lot higher than 40% in my experience. So there's a chemical imbalance. So with Parkinson's, there is obviously a lower level of dopamine within the person with Parkinson's, but there is also research recently that shows the lower level of serotonin. And serotonin is also a mood stabilizer, and it's a happy hormone. Just as much as dopamine, it stabilizes your mood as well as feelings of well-being. So mood regulation is affected if there is lower levels of serotonin and dopamine within the brain. And then it also affects your neural pathways. So those neural pathways are responsible for your emotional, behavioral well-being, perception, along with motor pathways. And these pathways with those with Parkinson's are disrupted then due to the lack of dopamine and the lack of serotonin. There is further research obviously needed, but the evidence has shown that people with Parkinson's also have destruction of serotonin neurotransmitter seen in the brain. And remember, the serotonin being your happy hormone, if that's of a lower level, it's seen to be specifically correlated with those with Parkinson's and depression. So it's not always down to the environment or out of your control. It's sometimes down to the Parkinson's disease itself. Some symptoms of anxiety. So there's physical, psychological, and then severe symptoms of anxiety that I have decided to split these into. So physical symptoms of anxiety would include sweating, pounding of the heart, so you can feel your heart beating quite rapidly, shortness of breath, chest tightness, and then gastrointestinal symptoms such as nausea or diarrhea, or the impending diarrhea as it is more known as. Psychological issues then with anxiety, or symptoms with anxiety, would include excessive worry, a sense of dread, ruminating thoughts, and very poor concentration. And then severe symptoms of anxiety would include a lack of insight or a lack of reality, irritability, poor sleep cycle, because obviously you're not able to switch off at night if you're at a heightened level of anxiety. May also be a symptom of depression, and also panic attacks. And panic attacks are a symptom of severe anxiety, but when people suffer them, it can be quite frightening. They're not aware of what exactly it is, because obviously if you have chest tightness, shortness of breath, you may not realize that it is a panic attack, but it's always important to see a GP or to attend a hospital to outrule anything else. Panic attacks typically last 15 to 20 minutes, or in some cases, unfortunately, they can last longer, and they're quite debilitating for those that experience them. An off anxiety then. So when you are wearing off and your level of your levodopa tablet, so your Parkinson's medications, be it Cinemet, Stalevo, or Madapar, when they are wearing out of your system, this can lead to anxiety. And then your symptoms decrease, and your anxiety increases, and your off symptoms are worse. There's no clear on-off phenomenon, but people may experience generalized anxiety, and if their motorist symptoms are left untreated, it's that cycle of anxiety, worsening symptoms, and further anxiety. So it's a cycle that has to be broken. Some treatments for anxiety then, so there's obviously pharmacological treatments, so medication, psychological treatments, and complementary treatments. And some complementary would be mindfulness and breathing techniques. Relaxation is found to be the key way to finding ways to cope with anxiety. It's learning to manage with techniques and therapies, so learning to cope and have the tips, I suppose, to deal with the anxiety before it spirals. Mindfulness has shown, research has shown recently that new neural pathways can be made. So it doesn't rewire the brain, but it does recondition them with very subtle changes. So it allows you to build upon your techniques and recondition your mind in a way of how to deal with the anxiety. Similarly, yoga, Tai Chi are very good for anxiety and relaxation. Exercise is a great form of relaxation, and that's exercise in any form, be it a walk or be it a gym session or one-to-one or a class or dancing. There's multiple methods of exercise that you can use that may help with dealing with your anxiety. Similarly, diet and lifestyle also play a very important role in the treatment of anxiety. So caffeine, alcohol, and cigarettes can be triggers for anxiety. Stressful work environment, stressful home environment, they contribute to it, but they're not always the easiest things to change in relation to anxiety. Then some psychological treatments then for anxiety would be cognitive behavioral therapy, which has been proven to be quite effective for people with Parkinson's and anxiety. Psychotherapy or counselling, or speaking with a healthcare professional or family member, be it myself or be it your neurologist or your Parkinson's nurse specialist, if you have access to one, or a GP, and actually speaking about it and acknowledging it is a very big step. And you'll always get benefit from speaking to somebody about it. So some pharmacological methods of treatment then for anxiety. So benzodiazepines, which some people may have heard of before, they're really short-term treatment. They do have an immediate effect, but they have their side effects, just like all medication. And they do alleviate the symptoms. So they will alleviate the symptoms of shortness of breath or that panic and fear, but they don't always treat the underlying problem. And some examples of your benzodiazepines would be alprazolam and diazepam. So Xanax or Valium are the other two common names for those. And they're used usually with caution. They may cause excessive drowsiness or sedation. Then in turn, they may cause unsteadiness of gait, slurred speech, and sometimes confusion. Most psychiatric drugs are not addictive, but benzodiazepines actually can be highly addictive and are used with caution. Usually it's a short-term course, as I said, so maybe 6 weeks, and then it would be reviewed, and also would usually be tapered down. So you'd be weaned down from these benzodiazepines to avoid any withdrawals. The SSRIs, or selective serotonin reuptake inhibitors. So these are another pharmacological treatment for anxiety, and they're usually the first medication used. Typically, these are the ones that most consultants or physicians would go to. So they're most common. They usually take effect within about 2 weeks, so they take that little bit longer, but they treat the underlying brain changes. So as I mentioned, serotonin is seen to be in lower levels in people with Parkinson's. So this is one of the methods to replace the serotonin reuptake. And an example of this would be escitalopram, or Lexapro is the brand name for this. As always with any medication, speak to a neurologist or a GP or a nurse specialist if you have any queries. So apathy. A lot of people don't know what apathy is, and it's really only working in the field of Parkinson's for so long that it stands out to me. It is becoming increasingly recognized in Parkinson's, and it's described as a lack of enthusiasm, a lack of interest, and a lack of emotion for everyday activities. So it can be mistaken for depression sometimes, but just because you experience this lack of doesn't mean that you have depression. It can be hard to diagnose, but it's necessary to talk it through with your consultant or physician, so it can be treated. And then depression. So depression is very difficult to diagnose, and it's not something that GPs or consultants would jump to as a diagnosis. Some symptoms of depression are very similar to those of anxiety: fatigue, fluctuating mood, negative outlook on life, low self-esteem, and unfortunately can be caused by some Parkinson's medications. You can also get an overwhelming sense of tiredness with Parkinson's. So it may not be necessarily depression, but as always, it's something to talk about and discuss with your consultant openly. So they can make an accurate diagnosis, they can discuss your medications with you, or discuss possible treatments that may be beneficial, be it medication or be it cognitive behavioral therapy. Severe depression then is something that you do have to mention, and it may result in suicidal thoughts or plans. It may also disrupt a person's sense of reality and make it much harder for you to function on a day-to-day, but it requires specific treatment. So always discuss any psychological issues that you may have with your GP, your nurse specialist, or your neurologist or geriatrician. So some helpful tools. Some people may find this beneficial. Even if you take one thing from it, it's something to come away with from. The daily positive affirmations. So I always find, and they're very popular these days, especially after the last while and the last few years that we've been through everything, but daily positive affirmations are positive thoughts for the day. So you can get them in card form or calendar form, or you can just think of something each day yourself without any prompts, and be positive for it or be grateful for it, I suppose. The Parkinson's Mindfulness Toolkit is something that I'd come across on the parkinsons.org.uk website. And it was a tool developed at the beginning of COVID. It entails a short video explaining the benefits of mindfulness for people with Parkinson's. It then has a full 15-minute audio session for mindfulness, and then 5 short videos on instructions on how to practice the mindfulness. So it's really good. It's a very good toolkit that I found. Then with the Parkinson's Association of Ireland, we offer yoga classes to our members, mindfulness classes with Dee Daly, and singing sessions with Dara McMahon, all on Zoom at the moment. And of course, different things work for different people. Even speaking to other people with Parkinson's may be beneficial to you, other than having to use any of these little tools that I've suggested, or speaking to your practitioner. So just a few little quotes that I thought were very apt and appropriate. Nothing is permanent in this world, nothing is permanent in this wicked world, not even our troubles, by Charlie Chaplin. Trust yourself, you've survived a lot and you'll survive whatever is coming, Robert Cho. And I like that one because people are always very harsh on themselves. I think maybe we're very doubtful of ourselves. And we forget what we've actually come through to get to where we are. So just remember that. Anxiety then is the handmaiden of creativity, T.S. Eliot. And be it creativity of the mind, or with art, or with singing, or with just getting out and having half an hour of time to yourself. That's all creative time as far as I'm concerned. And then feelings come and go like the clouds in a windy sky. Conscious breathing is my anchor. I like this one because we live in Ireland, and we know what a cloudy day looks like, and we know how quick those clouds can move some days. Other days it feels like they're barely moving. Remember, the clouds do move, and those feelings will come and go with them. So if the clouds move quickly, then hopefully those feelings can move quickly too. So in conclusion, with relation to anxiety, it's the recognition of the symptoms of anxiety, to recognize that is it a normal level of anxiety that you're experiencing, or is it a heightened and uncontrolled level of anxiety? And reaffirmation, so the reaffirmation of positive thoughts, empowering yourself with your life situation, and empowering yourself with the illness or disease of Parkinson's. And speak to somebody, so be it family, friends, your neurologist or Parkinson's nurse specialist. It's all beneficial, and it's something that is so common among people with Parkinson's. Remember that an abnormal emotional response to an abnormal situation is perfectly normal. It's okay not to be okay is something that we've all heard a lot over the last few years. Try and limit or avoid as much as possible negative media, news and hourly news updates, and limit your social media activity, because it's not all beneficial and it can be quite toxic. And then toxic positivity is something that I came across myself, which I would be a culprit of, unbeknownst, because I didn't know there was a title to it. But what they define it as is the assumption that we should always have a positive outlook, even if we're in emotional or physical pain. So it's unrealistic. And by acting more positive and happy would not always make us feel better. In reality, it's a way of shutting down your real feelings, and can often make us feel worse. So although I would be somebody who is always be positive and constantly positive, sometimes it can do more damage than good.